You're listening to The Physician's Mind, raw stories and real talks from people striving for greatness in medicine and in life. This is where ambition meets action and where the relentless come to level up. I'm your host, Curtis Wilkerson. Thank you so much for listening. Let's get right into it. Welcome back to the Physician's Mind podcast. Today on the show, I'm joined by Dr. Jane Manfredi, a powerhouse in equine sports medicine, a surgeon, scientist, and educator whose career embodies precision, grit, and the relentless pursuit of excellence. From the operating room to the research lab, she is redefining performance medicine. This is going to be a conversation about discipline, drive, and what it really takes to push the boundaries of human and animal potential. Dr. Manfredi, thank you so much for joining me today. How are you?
I'm great. Thanks for having me on.
Of course. So you've had a very impressive career working as a surgeon, a researcher, an educator. What was it that first sparked your passion for veterinary medicine and equine sports?
So I was fortunate when I was younger. My mom was actually a horseback riding instructor. And so I would tag along with her and watch her riding lessons, teaching lessons. And so she slowly got me interested in the horses, and I kind of got hooked. And kind of from that point on, I was like, well, I want my career to be involving horses in some way. What does that look like? And so when I was younger, I was involved with the United States Pony Club, which is like a youth group. It's similar to 4-H, but focuses just on horses. And it was horse health care and riding and all of these things at once together. And I really liked the part of it where they were emphasizing like horse welfare management and veterinary medicine areas. And so we had some really, really cool vets come and donate their time to teach us about horse health and care. And I pretty much thought that is a really cool path to take. And so I wanted to follow it, pursue it, and become at least a veterinarian to start. And then kind of later on, I got some idea that I wanted to take it further to go more into equine sports med, particularly in surgery as well as teaching. So, it started when I was very young and has kind of been something that I've had as a lifelong passion. And I'm happy to say that I'm here today because of some of those earlier memories with my mom and Pony Club.
Awesome. You've gone from being a racetrack veterinarian to leading an academic lab. What do you think are some of the key experiences that have shaped your professional mindset?
Yeah, so I should say, to back up a little bit, my goal pretty quickly once I got into vet school became to eventually come back into teaching and research. But I thought to myself, I think I need a few things in my toolbox before I get there. And so, my end game was to be in an academic institution doing exactly the job I'm doing now. But along the way, I realized that, getting some miles and experience in private practice and different types of private practice would really help me as a clinician as well as an educator. Because in veterinary school, a lot of our veterinary students just go straight from our 4 years of veterinary school out into practice, and that's what they have to deal with on an everyday basis. So some of it was a little bit by chance, and some of it was a little by intention. So when I got out of veterinary school, I did a year internship at Mississippi State, and really there we did both referral cases as well as private, more regular everyday care. Which was great. And I ended up going actually out to California for a number of years and working on not just horses, but also sheep, goats, pigs, llamas, and alpacas, which really kind of gave me the kind of adaptability, I think, that is valuable in my practice because, my time in private practice taught me how to think on your feet, work with what you have, and also see many different perspectives. I ended up at racetrack practice, not because I thought I would ever be in regulatory practice, but partially because of my spouse who ended up getting a postdoc in Northwestern. And so I was looking for jobs in that area. And, one of the things I hadn't done and that had opportunities immediately was working in the regulatory world at the racetrack. And the great thing there was that I was able to see about 80 horses every morning and looking at them for sports medicine and lameness, palpating all their joints, really doing thorough physical exams to figure out what was going wrong with these really high-end elite athletes. And so it kind of enhanced my sense of all my senses, palpation and skills and, visual ability to detect lamenesses and gait abnormalities, which has really served me well in my career as a surgeon and sports medicine clinician.
Well, what's really cool about the work you do is that it is at an intersection between these elite equine athletics and human health. What parallels have you seen between performance in horses and performance in people? Because I know that your work involves both.
So my interest in that largely, came from my own passion for riding dressage. So dressage is kind of like the figure skating of the horseback world. If you watch the Olympics, you might have seen Martha Stewart and Snoop Dogg talking about dressage. He talks about horses that are crip walking. So that's what I do, which is what I love. And so one of the cool things is that really as a rider, we are athletes and have some of the same issues and conditions that our horse counterparts do. Particularly some of my interests fall into the realm of osteoarthritis and musculoskeletal disease. And so with that, basically there's a lot of pressure to be able to continue and work and perform at the levels we want to be performing at when we are kind of managing, low grade aches and pains in many places. So the cool thing for me is that my research now often involves both the horses and their riders. And then in regards to working with the horses, really lets us look at some of the things that can also hopefully translate into what we can do in human medicine down the line, but we learn from human medicine too. So the cool thing with horses is that it really helps us kind of assess and test some interventions potentially earlier than we would maybe see in human medicine. And then we can also get a lot of greater array of biomarkers to help see how local changes in the joint itself or in the blood are reacting to some of the interventions that we're perhaps carrying out. The other cool thing is that horses, work with humans and riders, and so sometimes it's a little bit more easy to have them on a steady and consistent regimen for either exercise or rehab exercises than perhaps we're able to do with all of our human patients. So all of those are benefits in one way where I think really horses can be a great model for saying how can we improve musculoskeletal health, and what does that mean for our humans later and down the line.
Very cool. And one thing that medicine and sports have in common is high pressure. So how do you personally approach high stakes decision making when outcomes are really important?
Yeah, pressure exists in all kind of phases of medicine. And so one of the things I like to do is kind of game out a multitude of potentialities. So looking at possible outcomes of the surgery or rehab or intervention, and kind of what the different pluses and minuses of them are. And so I kind of, before I get into a situation or have a set kind of script or possibility pathways that I commonly take that I can then tweak to be appropriate to the patient in front of me. And so knowing that we have certain things that are definitely common injuries in the equine world, so soft tissue, as well as joint level injuries, that we have kind of a unique array of abilities to kind of treat, either prehab wise, so hopefully building up enough muscular strength and support to our joints, tendons, and ligaments to prevent injury, as well as surgical approaches to dealing with them and things afterwards. So I'm a really big planner about what are the tools I have in my toolbox, how can I apply them, if this doesn't work, what is the next step or the next step different. And I'm all of that is combined with, of course, we have the interesting conundrum of we have the patient, which is our sport horse, but we also have their owners as well. And so for us, really the communication and kind of informing the owners of what, the benefits of this treatment are, what are some downsides, what do we think prognosis are depending on the route we take is really an important part of what we do as veterinarians too. Perhaps more so because, again, our patients themselves can't speak to us, unfortunately. So, the other thing I do quite frequently is actually a visualization process. So if it's a surgery or if it's a joint injection or if it's a rehab plan, I actually, will go ahead and game that out in my mind as well. So I make sure that I'm prepared and then can kind of see where I might need to have other players come and interact with me. So where my veterinary nurses or technicians have to play a role and help make it a successful and safe treatment for the animals involved. So I'll kind of do, I mean, elite athletes do this too. I do this for my own riding. Essentially, ride the test or the performance that you're expecting, and then, essentially predict where you may have issues and what you would do in response, so that if it happens, you're quicker in that situation to address it. It takes some of the emotion out of it, and also kind of makes you a quicker response time, which I think can be very, very helpful when you are in a situation where, especially you have, in my case, often 1,200-pound animals having opinions about things. So,
very cool. I mean, that's interesting to hear. I mean, good communication, not only with the rider, but with your teammates, leveraging those members of the care team to optimize your approach. It's interesting to hear that you have a visualization process before going into some of those high stakes things, and then being a big planner certainly helps, and understanding where things can go wrong and planning accordingly. It's absolutely conducive to success. Are there any other habits or routines or non-negotiable things that keep you operating at a high level across your research, your teaching, or other clinical work?
Sure. Yeah, so I mentioned before, I am a horseback rider, and that is one of those things that has been non-negotiable throughout all stages of my career. I've been fortunate enough to be able to have a horse through college and vet school and residency and beyond. And I really think that's really helped me kind of focus on the end game, like why this is important, as well as, keep me balanced. It's physical exercise, it's mental exercise. It's different from, when you're studying for gross anatomy exams or for surgical procedures or whatnot. And it's something that I've done to like kind of a great level. So during my residency, even, which, as you know, is rigorous as it is in med school too, but I was able to kind of obtain my United States Dressage Federation gold medal. And what that indicated was I was proficient at the level, at the test that they ride at the Olympics. So not Olympic level, like I couldn't compete against them head on, but I could ride the same test as they could at a proficient level, which is, I think, something I'm pretty proud of. So yeah. The other thing that I like to do that helps within my professional and personal life is like try and really have like touch point meetings with like my mentees and my team. And so I'm really, really available to them. So we have, set meeting times, but, they all know that I'm, a text away from being able to help them if they need it. And so like really being seen as someone who is like we're all kind of collaborating and working together to a common goal, I think has really helped them during, stressful times when I have PhD students and other undergraduates and lab managers, and trying to like rally the troops, that they understand that I'm invested in this and invested in them as people. And if they need me for either professional things or outside of it for support, I am there for them too.
Yeah, that's really cool. And I would imagine being so passionate about that sport correlates directly with your performance within your career. And very impressive, by the way, to be able to ride at the Olympic test at a proficient level. That's really cool.
I didn't mention this earlier, but we were talking about pivotal things and pivotal moments of time. And I knew I wanted to be in veterinary medicine from an early age, but I didn't know I quite wanted this career until I was looking for a summer job after my second year of vet school. And I kind of came upon, like just, randomly Googling that Michigan State had a summer veterinary research program. And I knew actually when I was looking, I'm like, oh, wait, there's a really kind of famous equine researcher at Michigan State. Maybe she would be interested in me coming to work for her that summer. And so, I was going to vet school in Canada. And I thought, well, I'll just apply. They didn't say you can't apply if you're outside of MSU. So I sent in my application, and a little bit later I got a phone call and like, are you interested in coming? And I'm like, absolutely. That's why I applied. And they're like, well, it's not common we take, out of our vet school people, but sure, why not? You're a good fit for one of our programs. And so I actually ended up working for that researcher, Dr. Hillary Clayton, over the summer, and basically loved it. She was such a good communicator and obviously had such passion for what she was doing that it really swayed me to include research as a part of my career as a equine, clinician scientist. And so that was a cool thing that eventually actually then also drew me back to MSU because the people here were so great. I was like, wow, this is fantastic. And I made kind of like a 20-year plan of how I could eventually come back to MSU and essentially hold the position she did at the time, which is the Marianne McPhail Dressage Chair in Equine Sports Medicine, which I hold today.
That is a beautiful full circle moment, Dr. Manfredi, and very impressive. And it goes to show that you should never be afraid to reach out to someone, even if they're of high status, high acclaim, because you never know what opportunities lie. Dr. Manfredi, can you share a moment of failure or adversity that taught you an important lesson about resilience at some point along the journey?
Yes, when you're talking about, kind of failure, I'm a big one in believing that failure is like failing forward, and it's an opportunity for you to kind of reflect upon what's happened, take responsibility for that, and then move forward. And so I'd say one of the bigger ones I had was in veterinary medicine. We have to take national boards, but then we also have to take state boards sometimes, or we used to. And so if I wanted to practice in California, where my partner was at the time, I had to pass the California boards to be able to do so. And so the first time I took them, it was shortly after the NAVLE, which is our big vet school board exam that we have to pass before we can practice. And I probably walked in a little bit too confident in myself. I was like, oh, sure, I just passed NAVLE. This will be not a problem. Glanced at some notes, but really, didn't probably take it as seriously as I should have. And I went through and I realized, wow, there's a lot here I don't know. There's a lot that is specific to California that I didn't bother investigating and obviously should have. And so that was a moment where I was like, wow, learning is a lifelong process. And I can't just say, oh, I went to vet school and I know it all. There's always new things being discovered in medicine. And then there's also things that's more important in certain areas of the country. And so I didn't pass that year. I was fortunate enough, I ended up in an internship in another state, but it would have been very challenging had I still been needed to be in California. So the interesting thing was, I buckled down, took it much, much more seriously. And then the second time I went to take it, it was kind of a comedy of errors where a lot of things happened. The plane was late, so I got in later than I thought to California because you had to take it there. The morning thereof, I was supposed to use my husband's car to drive to Sacramento, and he actually had, they used to have these things that could lock on steering wheels that you can't cut off with anything, if you know what those are like. He forgot to give me the key to that, so I couldn't unlock his car, and then I didn't have a car to be able to drive, and this is kind of before Ubers really existed, and I'm dating myself now. So I'm there crying because I'm already stressed for the test. I'm late to come in, so I got in late. I didn't get sleep. His landlady actually saw me and took pity on me and was like, here, just take my car and go. It was about an hour and a half, 2-hour drive through, cities and whatnot. And so I get there just before to sit down for the test. Basically everything you can do wrong before a test happened. But because I had taken it seriously and prepared, that time I was able to successfully pass it. But it really... it was a story that made me reflect upon many, many things. And that again is when I talk and I say I'm a planner and preparer, that's, part of it now because of that early experience that made me realize that's a really important part to my learning and success as a clinician.
Wow. Yeah, it sounds like everything that could have gone wrong in that scenario did go wrong for the most part. But it's also interesting, thank you for sharing that, because I think medical students as well, and anybody in a clinical environment, it's important to remain humble because you can get inflated about your abilities and then basically get shocked by some things that you don't know. It's kind of happened to me already in the first month of med school. So thank you for sharing that. Let's move into your research and how that translates to human care a little bit. How do you see your equine research, for example, in metabolism or in osteoarthritis, informing treatment strategies for humans?
Horses and humans have really similar pathophysiology in terms of a couple things. So osteoarthritis, as well as metabolic disease. So that's kind of like type 2 diabetes in humans. And in horses, that's we call it equine metabolic syndrome. So in human medicine, they also call it Med-S. So both of those areas are really similar. And I think horses and humans are really unique in that oftentimes those two things can coexist. And so you can have endocrine or metabolic syndrome in a lot of our athletes that also have issues with osteoarthritis, and the same thing with horses. And so some of the cool things we're figuring out is that some of the kind of joint level changes that we see in horses are similar to what we see in humans that have metabolic disease and osteoarthritis. And that has not kind of been discovered before in horses. And it really allows us to, I think if we're talking about moving into precision medicine, I think horses and humans are very much placed in the point where we could be approaching this precision medicine approach. So really looking and targeting like what the different biomarkers, joint level changes, systemic changes in the blood are, and how we can positively influence them with our therapies. And so that's where I said it's really nice in horses because to help humans, because we can do some of these therapies and repeatedly sample and see how things are improving and changing in kind of like a rapid period of time to then, I think, hopefully leverage some of those therapies into the human world, knowing that they already have success in an athlete that has similar, kind of demands on their abilities as you would have in the human world. So that's kind of been very useful. And again, too, this kind of goes along with a lot of our rehab and our treatments where some of the same ones really help horses and humans. So, we use resistance bands, therapeutic ultrasound, a lot of the same rehabilitation modalities in horses. And I do have to say, I think we sometimes have actually more stringent follow-up on, looking what that looks like for recovery in our equine animals because they can't talk to us. So we do have to look at what improvements do we see on imaging? How does that change the, image we get on ultrasound or MRI, before putting them back into work to really gauge success of the therapy, and then also hopefully provide guidance that could, again, guide human approaches to similar conditions. So there's a really lovely translational One Health aspect to what I do. And already some of the kind of drugs that I work with partners or medications that I'm working with some of the partners with are the goal of using horses like as a large animal model to then help, develop and attract funding from other individuals looking to leverage it into the human market too.
Very cool. And your lab covers metabolic syndrome, osteoarthritis, rehab, and more. Is there one of your current projects that is particularly exciting to you?
Sure. So kind of a couple of cool things that we have kind of working on right now is, I alluded to a little bit before, is looking at horses that have osteoarthritis and also have metabolic syndrome and kind of really looking at what's in their joints and how that is different from, say, a horse that is normal that has arthritis. And so we actually see that there are very unique things in the joints, particularly in terms of some of the metabolites in the lipids family that are different in those horses than in other places. And I think potentially have unique or should have unique approaches to treating the inflammation and the pain in the joints coming from that pathophysiology system. And so kind of defining that horses have this unique metabolic osteoarthritis phenotype is going to be really, really helpful for hopefully guiding what we might do with humans, 10, 20 years, or hopefully sooner, but realistically probably 10 years from now down the line. And so we just kind of have that. We're just finishing up the paper to submit that. My PhD student just actually presented her thesis where that's one component of it. And so that is a pretty exciting thing that would, again, help hopefully horses and humans down the line. And then we've also done some other work looking at kind of novel approaches to treatment of arthritis. I have a kind of a colleague where we've looked at using like DNA aptamers to actually approach treating arthritis in horses. And so we're following up on that for a more of an inflammatory profile within osteoarthritis. In that case, we're using DNA like not as a genetic modifier, but actually kind of as a drug to help kind of bind some of the inflammation that's occurring within the joint itself. So those are kind of a couple things that we're really looking at. We're really looking at the future of treatment, because we know that steroids are deleterious to the joints, and we all would like to move away from actually harming while we're trying to do good. So those are some things we're looking at now.
It's incredible. Very interesting research, and it's so far beyond what I can comprehend right now. It's just cool to see the gap between understanding and how much there is to learn. So thanks for sharing some of those current projects. I think that's really interesting. Now, you're also involved in teaching and mentorship. So let's transition a little bit into what you think makes students successful. I mean, you are very heavily invested in teaching. This includes simulation, this includes active learning. In your opinion, what do you think today's medical and veterinary students need most to thrive in their path?
Sure, that's a great question. Yeah, education is really important. I think it's like really the base of what I do and what, drives me. So all these research things, I take them back into the classroom and, share them with students so they can see that, it's a continuous process of improvement and understanding in medicine. And so what I think is really important a lot of the times with teaching is like authentically practicing what they're going to see and do in a safe, supervised setting. And so why I say that is a few things. So one, practice makes permanent. So we not necessarily perfect. So we want to make sure that they are performing whatever skill they're doing like correctly, and they're not just learning muscle memory for something that's incorrect that's going to be harder to unlearn. It also really helps them, I think, see and develop their like professional identity that, hey, I want to be an equine practitioner one day. Hey, it's my first year of vet school, and now I'm ultrasounding horses' tendons, just like I would do when I'm in practice. Hey, I'm ultrasounding their intestinal contents, just like I would do if they had colic or abdominal pain in practice, and really linking that up with gross anatomy to kind of get the three-dimensional picture in their head. It also helps really build some of those tactile skills that we know are really hard for students to develop, starting them from like an earlier stage in their career. So they're, applying their basic anatomy in a very real way that helps them already kind of scaffold these things together. So you have your gross anatomy picture, you have your textbook learning, you also have your three-dimensional like understanding of the ultrasound anatomy as you're going through it. So it's been a very key point for me is like learning by doing, because so many times, when I went through vet school, what I realized was, sure, if you showed me an anatomy specimen on a table, I could tell you this was the superficial digital flexor tendon, etc. But then you ask me, okay, well, where is this in the live horse? Or, what does this look like in ultrasound? And those were really hard jumps to make. So we're trying now to have students be able to put those pieces together much earlier. And I think that is like a great way forward.
Curious, how do veterinary students approach gross anatomy? Is there just several animal models that they study? How does it work?
Sure. So there's a few ways we do it. And I will say, before I had my current position, I was heavily in anatomy, like 55% of my teaching was anatomy and clinical skills. And so in veterinary school now, we do a few things. So we have ability to work with live animals. So we have horses that are very kind and very willing to let the students learn on them as far as how to do physical exams, where are all the different anatomy parts, where are those joints and tendons located? We have then a will donated program for like specimens, so for cadavers. So people whose horses had to be euthanized for other reasons say, please, let's use them for teaching as well. And so we'll have the ability for our students to, dissect a leg to see where all those tendons are, to do exercises to see how they work to help hold the leg up. What happens if this one is injured or cut? So we have a live animal component, a cadaver component. We do have also pre-recorded videos where we go through dissections, as well as like the ability to use like some of our 3D modeling programs to kind of rotate the bones. And students also do have hands-on access to bone specimens as well. And so as part of that, we've also then integrated some of the imaging components. So, where would you stand to take this radiograph? How would you perform this ultrasound? Because in vet med, we are the ones doing those things. This is a little maybe different from some of the med school approaches where you go on it specialized, but we do draw the blood, we take the radiographs, we do the ultrasounds ourselves oftentimes. So those are incorporated into our anatomy labs as well as different kind of sections. So I like to think it's a pretty broad perspective on anatomy. I'm curious, like, for you in human medicine, like, do you have more like do you synthesize models of it, or do you still have cadaveric assessments, or what do you guys do? You all do?
In my experience, we have a blend of both. So where I go to school, we have the cadaver lab with several dozens of donors that have been dissected for particular purposes, be it superficial, intermediate, or deep. And we're allowed to basically fully examine the specimens, or rather the donors, and study them for our anatomical purposes. And then we also have online models as well that we can I like to use the online models occasionally before going into the lab, so I have somewhat of an idea, and then I'll go in and then much easier be able to identify it on the actual donor. So we also take a comprehensive approach like that. For you guys, is it with multiple animals?
Yep, so we'll do multiple species, yep. So we'll have dogs, cats, and then the horses and ruminants, we typically do targeted areas. So the ones that we're kind of most concerned about. So, for example, if it was cows, we have, unfortunately their GI system has some issues. So we'll have like a rumen in the 4 parts of the cow stomach where they can look through and see those parts, because they might need to do surgery on multiple of those parts. For horses, we'll look at like stomachs, because they tend to get ulcers very commonly too, like humans, especially if they're in competition and performance. And then we'll have a lot of like distal limb and musculoskeletal like joints and things because of the frequency of osteoarthritis and tendonitis and other issues like that. So we do see kind of a breadth of species. So I would say cows, sheep, goats, some pigs, horses, cats, dogs. And then sometimes we'll do some either chickens or fish, depending on like interest in some certain subspecies. Those are sometimes more optional labs depending on the individual's interest or availability of those specimens. So yeah.
Very interesting. Yeah, have not really inquired about how that works in vet school, so it's interesting to hear. Can you share, in your experience, going back to student success, what is it that separates the average students from those who truly excel in their clinical skills? Because I think those traits that you've seen in successful vet students will also apply to med students, or really any student. So what would you say you've observed?
Sure. So I find that there's a few things that kind of push the student kind of to the next level. And so one is their ability to like make connections between things, to really think about, if this changes here, what else does that affect in the systems, right? So, if they develop muscle atrophy because of an injury, what effects is that going to have to do on the joints, and like what joints might be the most affected and or have problems, or if they have endocrine disease, okay, so we're changing the balance of things here. How does that affect bone growth? How does that affect liver metabolism? How does it affect, heart rate, blood pressure? So really the students who kind of take a couple of the different systems that we go through and try to find like kind of systems interconnections between the two and make stories and say, if I change this, if I gave a drug that blocked X, if I gave a drug that enhanced Y, what happens in the downstream environments? I think that's really key, because they're making a story of understanding relationships. And so a lot of what we do, like there's too many facts to memorize, to just memorize in med school or vet school and to get by to really understand it. To really understand it, you need to make those connections, understand the patterns of how things relate together. And that takes grit, okay, which, it's a challenging thing. It's hard to go through sometimes and be like, immunology is maybe not something I'm most passionate about, but yet it's, so vital or critical for here and there. So, students who are willing to take the time, have the grit to make those connections and put in the time really are the ones that seem to thrive during vet school and beyond.
Very cool. Yeah, and that's an absolute correlate to medical school. The ability to make connections between systems, having the grit to do what must be done even though you may not necessarily want to do it, and just putting in the time, putting in the work. Absolutely. Now, you have balanced roles in your career as a surgeon, as a scientist, as a mentor, as an educator. How do you manage these competing priorities without feeling burnt out?
Yeah, so it helps that, I really truly do feel like I had a calling for this area and I have a passion for what I do. But I also have a really good, strong circle of family and friends that, also support me and who I can find, happiness with and, calmness with. And then I also have a very well developed sense of hobby through the horseback riding, which again, kind of also reminds me of the big picture of why I'm doing what I do for the, welfare of the horse. So, I think that ability to have, close friends and family as well as like a dedicated hobby, I think help keep not everything. I don't think we ever have like complete balance in life, but it helps like the teeter-totter seesaw, sway enough that it stays afloat. Okay. So yes, sometimes research might be more demanding, but then, I'll do like a family activity or vacation, or then I'll ride my horse. And so, it's kind of like a balance moment, not totally in balance ever, but like a pendulum that, kind of swings back and forth, but, doesn't touch the ground. So I think that's been really important to me. And I'm very grateful I have them in my life.
Yeah, that's great. And I can relate to you in the pendulum analogy because I'm sort of the same way. I'll go in and work very hard, for example, leading up to an exam, and then take a complete break to the degree that it's possible, of course. And it's just kind of like work hard, play hard mentality.
Mm-hmm. Yeah, and I agree. Now, hopefully that's what you're doing in Arizona, other than you are working maybe now, but hopefully you're having some fun too.
Of course. And like you said, when you're passionate about it, it doesn't necessarily feel like work. And that's kind of how it feels with this podcast and all of these things. So it's something I think it helps when you really enjoy it. It doesn't really feel like work. It doesn't feel like an obligation. It's something you actually appreciate doing. So on that note, is there a core principle that has guided your decisions across your career?
That is like a tough one. I know, we're talking and like thinking about that. And I guess for me, it's just really was, finding my passion, looking at horses, veterinary medicine, and realizing that, I had a unique ability to be, a horseback rider, an athlete, and then improve the welfare of the horses themselves in like a bigger picture. And through, yes, I have direct equine clients, so I can help an individual client, but then I also feel like I can contribute to the growing body of knowledge of how to help a wider population of horses too. So for me, that ability to kind of like keep this growth of knowledge, has helped kind of like fulfill my passion and help me feel that I have the effects long lasting for horses, their owners, and the students that I teach and mentor. So I feel like to me, like that ability to feel like my daytime and work is impacting so many people and animals on different levels has really been a driving force for, what I do and why I do it. I'm just in an incredible position. I'm so grateful to be here and so grateful for everything that I've been able to do so far and hopefully continue to do in the future.
Yes, it is a great blessing to be able to continually pursue that which you have determined to be what you're passionate about. When you have the ability to work hard and challenge yourself and become better at your chosen goal, there's not much that's better than that in life to give you a deep sense of meaning. Dr. Manfredi, if there was one lesson that you could hope a young physician or veterinarian or student could take away from our conversation here about excellence and long-term growth, what would that be?
I think that would be, and I think you touched upon it sooner, is like, don't be afraid to like ask. And so whether that ask is, to someone who you really esteem and who you want to work with, or if you have a question for them, or if you want to do a new procedure or think about a research project, like asking the people who can help you get to your goals. And, most of the time you're going to get yeses. Sometimes there may be some no's. Sometimes there might be some failures. But that continual growth, that continual ask and curiosity, I think is really been important to me. And I think it can really help a lot of clinicians in the future.
Excellent. Dr. Manfredi, thank you so much for joining me today. Can you share with us what's next for your research or for your teaching, and how can people follow your work or get in touch with you?
Sure. So I'm going to continue my work looking at that intersection between osteoarthritis and endocrine disease in the future in horses, as well as probably helping out with some humans through our new connection with Henry Ford Health. So we had a nice symposium recently where we got together as musculoskeletal researchers and we're talking about that. So looking forward for relationships there to become more prominent in the future. And then I'm also going to be looking at just some specific horse rider interaction during dressage and other kind of sports to see how we can kind of optimize horse athletic longevity, rider athletic longevity as well, while performing these kind of higher level sports. And so right now, if people are interested in finding me, if you look for Manfredi Encore Lab McPhail Equine Performance Center, I'm also on Instagram. And the website is a continual work in progress too, but I should be soon having a whole bunch of posted links to podcasts such as these, as well as links to some of my papers. I am doing my best to where I can to actually make the papers open access, so there's no paywall, so people can read them from all walks of life and not just if you're in an academic institution. So that would be another option pretty shortly in the future.
Excellent. All righty, folks. Well, we have been talking with Dr. Jane Manfredi. Dr. Manfredi, thank you so much for joining me today, ma'am. I really appreciate your insight and your time.
Thank you so much for having me. I had a great time.